South Asia is grappling with a silent epidemic, snakebites. Millions face the terrifying reality of venomous snake encounters annually. WHO estimates over 1 million snakebites occur annually in India alone. The true scale remains uncertain due to underreporting, especially in rural areas. Many victims lack access to formal medical care. Traditional healers often become the first line of treatment. The consequences of this silent epidemic are devastating. South Asia is home to a diverse range of snake species, many of which possess venom capable of inflicting serious harm to humans. Among the most notorious is the Russell's viper, a stout-bodied snake responsible for a significant number of bites. Its venom disrupts blood clotting, leading to internal bleeding and organ damage. Another formidable foe is the Indian cobra, easily recognizable by its distinctive hood. Cobra venom attacks the nervous system, causing paralysis and respiratory failure. The common krait, a nocturnal snake with a deceptively gentle appearance, delivers a neurotoxic venom that can be fatal if not treated promptly. These snakes, along with other venomous species like the saw-scaled viper and various pit vipers, pose a constant threat to rural communities where encounters are more frequent. It is crucial to understand the behavior and habitat of these snakes to mitigate the risk of bites. Behind the staggering statistics lie countless personal stories of fear, pain, and resilience. Farmers working in rice paddies, children playing in fields, and women tending to their homes, snakebites do not discriminate. Take the story of Rani, a young mother from rural India. While gathering firewood, she was bitten by a Russell's viper. The venom spread quickly, causing excruciating pain and internal bleeding. She was rushed to a distant hospital, but the journey was long and treacherous. Rani survived, but the ordeal left her with debilitating pain and a fear that continues to haunt her. Then there's the tragic tale of Anil, a young boy who succumbed to a cobra bite while playing near his home. His family, devastated by the loss, grappled with the harsh reality of a life cut short by a preventable tragedy. These stories, though heartbreaking, underscore the urgent need for greater awareness, accessible treatment, and proactive measures to prevent snakebites in the first place. Section 5. The Antivenom Dilemma, a race against time. Antivenom is the only effective treatment for venomous snakebites. It is a life-saving medication derived from the antibodies of animals, usually horses, that have been immunized with snake venom. Time is of the essence when it comes to antivenom administration. The sooner it is administered after a bite, the better the chances of survival and minimizing long-term complications. However, access to antivenom remains a significant challenge in South Asia. Production is often insufficient to meet demand, and distribution networks, especially in rural and remote areas, are inadequate. The high cost of antivenom further exacerbates the problem, making it unaffordable for many who need it most. The development of new and more effective antivenoms, coupled with efforts to make them more affordable and accessible, is crucial to combating the snakebite crisis in South Asia. This requires collaboration between governments, healthcare providers, and research institutions. Section 6. A changing climate, a growing threat. Climate change is emerging as a significant driver of the increasing incidence of snakebites in South Asia. As temperatures rise and rainfall patterns become erratic, the delicate balance of ecosystems is disrupted. This affects snake behavior and distribution, leading to more frequent encounters with humans. Droughts, for instance, can force snakes to venture closer to human settlements in search of water and prey. Floods, on the other hand, can displace snakes, increasing the likelihood of encounters in unexpected locations. As climate change continues to alter environmental conditions, the risk of snake bites is likely to escalate, posing an even greater threat to human health and well-being. Addressing climate change through global efforts to reduce greenhouse gas emissions is crucial. Simultaneously, local adaptation strategies are needed to mitigate the impact of climate change on snake behavior and reduce the risk of snake bites.
Section 7. Guardians of the ecosystem. The vital role of snakes. While snakes are often perceived with fear and aversion, it is important to recognize their crucial role in maintaining ecological balance. As predators, they play a vital role in regulating rodent populations, which can otherwise damage crops and spread diseases. Snakes also serve as prey for other animals, forming an integral part of the food chain. Their absence can have cascading effects on the entire ecosystem.
Efforts to mitigate snake bites should not come at the expense of harming snake populations. Instead, strategies should focus on promoting coexistence and minimizing human-snake conflict.
Section 8. Bridging the knowledge gap. Awareness and education as first lines of defense. One of the most effective ways to prevent snake bites is to empower communities with knowledge and awareness. Educational programs can teach people how to identify venomous snakes, understand their behavior, and take precautions to avoid encounters. Simple measures like wearing protective footwear while working in fields, using flashlights at night, and keeping homes and surroundings free of clutter can significantly reduce the risk of snake bites.
Community-based awareness campaigns, utilizing various media like posters, street plays, and radio broadcasts, can reach a wider audience, especially in rural areas with limited access to formal education.
Section 9. Building resilience. Strengthening healthcare infrastructure and antivenom access. Strengthening healthcare infrastructure is paramount in addressing the snakebite crisis. This includes establishing more healthcare facilities in rural areas, ensuring a steady supply of antivenom, and training healthcare workers on effective snakebite management. Mobile medical units can play a crucial role in reaching remote communities and providing timely treatment. Investments in research and development are needed to develop more effective, affordable, and accessible antivenoms.
International collaboration can facilitate technology transfer, knowledge sharing, and capacity building in the field of snakebite management. Section 10. Coexisting with nature towards a future free from snakebite fear. The issue of snakebites in South Asia is complex and multifaceted, but it is not insurmountable. By understanding the factors that contribute to snakebites, we can develop comprehensive strategies to mitigate the risks and protect human lives. Awareness and education, coupled with improved healthcare infrastructure and access to antivenom, are crucial steps in the right direction. By fostering a deeper understanding of snakes and their ecological importance, we can move towards a future where coexistence replaces fear, and snake bites become a rare occurrence rather than a silent epidemic. The journey towards a snakebite-free future requires collective action, innovation, and a commitment to protecting both human and environmental health. Together, we can turn the tide against this silent killer and create a safer, healthier future for all. Section 10. Coexisting with nature towards a future free from snakebite fear. The issue of snakebites in South Asia is complex and multifaceted, but it is not insurmountable. By understanding the factors that contribute to snakebites, we can develop comprehensive strategies to mitigate the risks and protect human lives. Awareness and education, coupled with improved healthcare infrastructure and access to antivenom, are crucial steps in the right direction. By fostering a deeper understanding of snakes and their ecological importance, we can move towards a future where coexistence replaces fear, and snakebites become a rare occurrence rather than a silent epidemic. The journey towards a snakebite-free future requires collective action, innovation, and a commitment to protecting both human and environmental health. Together, we can turn the tide against this silent killer and create a safer, healthier future for all.